Well, joining me now to discuss the impact this pandemic is having on Native populations, Kevin Allis, the Chief Executive Officer of the National Congress of American Indians. Welcome to the program.
Good evening.
Now, as we're seeing, the Navajo Nation, a Native American tribe on the U.S.'s largest Indian reservation. Now, it isn't a state, but it ranks number 3 behind New York and New Jersey in per capita cases of confirmed coronavirus. So give us the latest on what's happening in this community and why the Navajo Nation is being affected so much.
I think what you're seeing there in certain parts on their reservation is what you're seeing in the rest of the country. In some of our more highly populated areas in Navajo country, we're seeing large outbreaks. Currently, according to IHS statistics, there's over 1,400 people have tested positive. The population of the Navajo Nation is a little over 330,000 people, and only 6,343 people have been tested. So, you know, we're really concerned about that particular area around Tuba City and different, you know, very not dense populations like you see in metropolitan areas in the rest of the country, but within Indian country, fairly dense. And as you mentioned in opening up this story, the health disparities and the overcrowded home situation on this reservation and like many across the country, which is at least 16 times the national average, really creates a very tenuous situation and almost a tinderbox, if you will, should this virus catch fire in one of these communities.
And you mentioned testing, obviously things like access to health care and protective equipment, calls for faster test results, contact tracing, obviously things all the country is struggling with. How are Native American tribes coping overall with this? And what do you see as their biggest challenges?
So the biggest challenge has been another thing you mentioned early in the story is long-term underfunding for health care. And what that's created is a situation that is ripe for a disaster when a pandemic like COVID-19 appears in the environment. The national spend for health care per individual in the country outside of Indian country is just under $10,000. The federal spend per capita in Indian country is 1/3 of that. So what you see then, it should be no surprise to anybody when you see some of the health disparities you spoke about that are multiples of what the rest of the population is, and the health care is difficult because many of these reservations are in remote areas of the country. It is often there's a long distance for many tribal members to get to a particular health care facility, and then because of the underfunded situation, even though Congress has in the recent COVID bills has worked hard to get money to IHS, they just didn't have the infrastructure to be able to implement that as quickly as you would like. We're starting to see some positive momentum in that, where more beds are being rolled out, PPE and personnel, but it's been a struggle.
So then when we see these big announcements for funding for small businesses and for individuals, how much of that funding is actually apportioned for tribal lands? And is the amount that's being set aside enough given the disproportionate rate of cases?
Yeah, so Congress in the COVID-3 bill authorized and appropriated a little over $10 billion for Indian country. The real need, as we calculated it, is somewhere around $50 billion. And that might even be an underestimate to deal with all the disparities that exist, the remoteness, housing situations, you know, all things that have been underfunded for such a long period of time that the delta between what's available and what's needed is a big gap there.
And obviously the U.S. doesn't have a national lockdown. We're having individual state governors using their own judgment regarding things like lockdowns and business closures and reopenings. Does the same apply to tribal reservations in those states, or do they set their own? And how is that impacting them?
So tribes are taking their governments, okay, just like your state government, your local governments, and the federal government. So tribes are doing the best they can to contain a situation or keep their community safe. Communities like the Cheyenne River Sioux tribe, they've deputized dozens of tribal members to populate checkpoints along the way to make sure they're watching who goes in and out. Certain tribes many have declared a national emergency. And so what you're seeing happening outside Indian country is happening within Indian country too. Tribes are trying to do the best they can with the minimal resources they have to keep their communities safe until more of this funding will reach their communities that has been appropriated by Congress in the COVID bills.